Hi, I'm Cassandra Huck, a pharmacist practicing in Sudbury, Ontario. I currently work in the community pharmacy setting at a location where we have a high number of patients prescribed opioid agonist therapy. I've been asked to talk about how the current pandemic may be affecting patients with substance use disorders and to review some of the changes we may see in opioid agonist therapy prescribing patterns at this time. How do we anticipate an emergency like COVID-19 may impact patients with a history of or active substance use disorder? During emergencies, patients may have difficulty obtaining their usual treatment and services for substance use disorders, as well as other health conditions. Many physicians' offices have closed or may have reduced hours. Many support groups are canceling meetings to aid in physical distancing efforts. The increased level of stress associated with an emergency like COVID-19 can also trigger individuals to relapse or increase substance use as a method of coping. As pharmacists and one of the most accessible healthcare providers, it's important we know what resources are still available to our patients and share the pharmacy's plan for continuing to provide care. This alone can help to alleviate some of the stress our patients are experiencing, particularly around whether or not they're going to have to go without medication at some point. I've noticed a lot of patients have that fear and a lot of stress related to that. So just providing reassurance can help to minimize the stress that they're experiencing. There are also reports that disruption to the global supply chain have impacted illicit drug supply of substances like fentanyl and methamphetamine. This is creating shortages and driving prices up. This has the potential to lead individuals to try a new product or supplier, which could increase overdose risk, as it's difficult to know exactly what's in a new product. At my pharmacy in particular, we've seen an increase in the number of new patients seeking treatment over the last few weeks. Another reason we may be seeing an increase in overdose rates is that patients who do not normally use alone may be doing so due to physical distancing or self-isolation. So normally we would advise patients not to use alone, always use with somebody else present in case of an overdose, but that's difficult to advise right now because of the physical distancing efforts. If you have a patient actively using opioids or at risk of a relapse who does not yet have a naloxone kit on hand, it's an important time to ensure that they have one and are properly trained to self-administer it. What changes may we see to methadone and buprenorphine prescribing patterns as a response to COVID-19? A guidance document was created by CAMH in collaboration with the Ontario Medical Association and Medify to help guide decisions around methadone and buprenorphine prescribing during the COVID-19 pandemic. Based on this guidance, many patients who were previously ineligible for methadone or buprenorphine carries under the CPSO MMT guidelines may be prescribed exceptional carries. This is to encourage patients to physically distance themselves and reduce the number of clinic and pharmacy visits while still considering the patient's safety and potential risk of diversion. There will be less emphasis at this time on urine drug samples in determining if carries are provided, and more on a patient's social stability and their ability to safely manage carries. Given buprenorphine's safety profile, a higher number of carries may be given more readily with buprenorphine than with methadone. In addition, the requirement for a witness dose may temporarily be waived by the physician in order to minimize time in the pharmacy. With methadone, many patients who were previously level 0, meaning they had no carries, but who are deemed suitable for them under the current circumstances, may be started with up to 3 carries per week. It is suggested these be dispensed on non-consecutive days as a way of reducing the number of pharmacy visits while also reducing the risk of misuse or diversion of a larger quantity at once, as by witnessing on non-consecutive days, the patient would only have 1 carry on hand at a time. Many patients who were previously receiving 5 or 6 carries per week may now be dispensed up to 2 weeks at a time or more, up to 4 weeks in certain circumstances, because many of these patients could be receiving high number of carries or be receiving carries for the first time. It's important we are extra diligent in assessing them when we do see them and in making a point to check in on how they are managing. In what other ways might this patient population be impacted? Many of the resources and supports our patients might access, such as shelters, outreach programs, Ontario Works or ODSP offices, may not be open at this time, depending on the location. Patients experiencing homelessness may be at an increased risk of contracting the virus due to the inability to physically distance and the lack of access to hand washing or other sanitation measures. Patients with uncontrolled chronic medical conditions due to their substance use, uncontrolled diabetes, for example, may be at increased risk of complications if they do contract the virus. So again, as pharmacists, we are one of the main healthcare team members these patients will be seeing. It's important we provide education on measures to help minimize the risk of the virus transmission and monitor our patients closely at this time. Thank you for watching, and I hope you find this information useful.